Physiotherapy and massage are both widely available in Malaysia, both address pain, and both involve hands-on treatment, which is exactly why so many people end up choosing between them without a clear basis for the decision. Getting the choice right matters, because choosing the wrong treatment for your specific condition wastes time and money and, in some cases, delays recovery or makes the underlying problem worse. Here is the framework. Massage is effective for a specific category of problems: generalized muscular tension, accumulated postural tightness, stress-related soft tissue aching, and post-exercise recovery for athletes without structural injury. When a skilled therapist applies manual pressure to soft tissue, they increase local circulation, reduce neurological muscle tone, and provide sensory input to the nervous system that temporarily reduces pain signals. For someone sitting at a desk for 10 hours a day with general upper back and neck tension and no specific structural complaint, a good massage is a genuinely appropriate treatment. The single diagnostic question to ask yourself is, how long does the relief last? If a massage gives you improvement that holds for 5 to 7 days, and the overall trend over several weeks is getting better, massage is likely addressing the actual problem. If the pain returns within 24 to 48 hours after every session, your body is communicating clearly. Massage is relieving a symptom, and the cause of that symptom is something else entirely. Physiotherapy begins with a diagnosis rather than a treatment. Before any hands-on intervention, a physiotherapist takes a clinical history, observes how you move, and performs a structured physical examination to identify specifically which structure is involved, what stage it is in, and what is driving the problem. That diagnostic step is what separates physiotherapy from most other hands-on treatments. Consider neck pain presenting as chronic upper trapezius tightness, one of the most common complaints in Malaysian office workers. Massage relieves the tightness, the patient feels better, and books again 2 weeks later when the tightness returns. If the underlying driver is a cervical facet joint restriction forcing the upper trapezius to overwork as a compensation for missing joint range, that tightness will return within days every single time because the restriction has never been treated. A physiotherapist identifies the restriction, uses joint mobilization to restore movement, prescribes specific exercises to maintain that mobility, and the muscle stops being recruited as a substitute for a range the joint should be providing. That is a different outcome from a cycle of temporary relief. Knee pain that presents as muscular tightness around the joint might appear to be a candidate for massage. But if the diagnosis is patellar tendinopathy, compression over the tendon can aggravate the condition rather than help it. Tendons with reactive tendinopathy need progressive loading to adapt and recover, not sustained pressure. Applying deep compression to an irritated tendon delays recovery rather than accelerating it. The acute injury rule is absolute. In the first 48 to 72 hours after a sprain, a muscle tear, or a significant joint strain, deep massage over the injured area increases vascular permeability and can worsen swelling and secondary tissue damage. Physiotherapy manages the acute phase with appropriate protected movement, taping, load guidance, and specific exercises within pain limits. Post-surgical rehabilitation, neurological conditions, spinal canal problems, and any condition producing radiating nerve symptoms all require physiotherapy assessment as the primary treatment, not massage. The practical guide: choose massage when pain is mild, muscular, generalized, and has previously responded to massage with lasting benefit. Choose physiotherapy when pain is recurring, involves a specific structure rather than general tension, followed a clear mechanism of injury, produces nerve symptoms, or has responded to massage only briefly before returning. Post-surgical rehabilitation is another clear case. After any orthopedic surgery, knee replacement, rotator cuff repair, spinal fusion, the prescribed treatment is physiotherapy, not massage, because the program targets specific tissue healing, neuromuscular reactivation, and progressive loading that manual soft tissue work cannot substitute for. Physiotherapy for a hypermobile patient focuses on strengthening and motor control, not releasing tension. When genuinely uncertain, start with a physiotherapy assessment. A physiotherapist can identify whether massage is appropriate and can incorporate manual therapy techniques within a complete treatment plan where they add value. The full comparison article with further clinical context is in the link in the description.